We have all been somewhere with a baby or child in the back seat. Some of us have been places with a baby or child in the back seat while people were smoking. We all know that if you smoke, the baby probably lives with you, and if you smoke, you probably smoke in your home. Have you ever thought of the damage that you are doing to not only yourself, but the baby's little body and lungs? I can personally say that I have seen both. I have seen a girl smoke both in her home and in her car with a baby. I have seen the effects that it has on a baby's body. That's why I think that smoking around babies and children should be banned. Although cigarettes taste good and calm your nerves, they are bad for not only you, but your baby. Smoking claims approximately 440,000 lives a year. Smoking causes lung cancer, heart disease, and respiratory problems. More than 3,000 people die from lung cancer, 46,000 from heart disease, and 150 to 300,000 die from kids under the age of 18 have serious respiratory issues. If smoking doesn't take your life completely, it'll take 10 years at the least. Smoking has effects on the smoker's body and self-esteem. Smoking causes blood vessels to constrict, which causes your body to work extra hard to pump blood. Smoking leads to lung cancer. Smoking leads the lungs to inhale over 60 chemicals that cause cancer and harm to the body. Smoking doesn't only affect the lungs though, it also affects the heart. Smoking affects the self-esteem. Smoking causes bad breath, causes you to smell, causes yellow teeth and bad breath that gum and mints don't help, wrinkles and age spots. It's fine if you want to harm your own body, but why should us people that don't smoke or babies that are around you have to suffer from your habits? Smoking takes an effect on people that are around smoking also. Smokers only inhale 15% of the smoke. The other 85% is expelled into the air for others to inhale. 54% of children aged 3 to 11 are exposed to secondhand smoke. As an overall total, 88 million people are exposed to secondhand smoke. People around secondhand smoke are 25% risk of getting lung cancer. I know we all love our babies. Why would we continue to smoke around them and harm their little bodies also? I feel that smoking should be banned in 2 locations. First, a car. Second, a home. And a car is the most important to me because it's so small and refined area. Although parents try to roll down the window to let some of the smoke out, it doesn't work. My mother used to smoke around me when I was little, and she thought she was doing a good thing, but she wasn't. Some of the smoke went out the window, but most of it blew back in my face. I don't understand. I know parents love their children with all their heart and wouldn't want anything bad to happen to them. So why would they smoke around the children? They're doing something bad. Quitting smoking not only has good effects for the smoker, but also for the people around it. If you stop smoking, your body can recover from some of the damage. Blood circulation increases, cancer decreases, heart disease decreases, lung cancer decreases, and the risk of infertility decreases. After the first 3 months, lung function improves. After the first year, heart problems decrease tremendously, by 50% to be exact. If you stop smoking around your baby and children, their risk of respiratory problems can decrease also. We do everything we can to keep our babies safe and healthy, but in reality, if you smoke around them, then you're causing most of their problems. That's why I think banning smoking around children in cars and homes is the best. If you want to smoke, at least stop smoking in your homes and cars that you have your baby or children in. This is the home in the car that I think smoking should be banned in. This is the wrinkles that smoking causes. This is what it does to your teeth. It makes them yellow. And this is a healthy lung, and this is a smoker's lung, which is pretty bad. And this is a little chart of after you quit smoking. 20 minutes after, the heart rate and blood pressure decreases back to normal. 12 hours, the level of carbon monoxide in the blood is normal. 2 weeks, circulation and lung function improves. 1 to 9 weeks, coughing and breathing problems begin to disappear. A year after, the risk of heart disease reduces to 50%. 5 years, the risk of throat, esophageal, and bladder cancer drops to 50%. The risk of cervical cancer and strokes drops also. 10 years after, the risk of dying from lung cancer drops to 60%. 15 years, the risk of heart disease is equivalent to the non-smoker.